The biology of lymphoma is pretty amazing. And the reason is the cancer in this case is the immune system. So often we're trying to get the immune system to fight against the cancer, but in this case the challenge is the cancer is the immune system itself.
Lymphoma is a cancer of infection-fighting cells in the body called lymphocytes. It can form tumors in the lymph nodes, in the bone marrow, in the blood, and in other organs, pretty much anywhere in the body.
And so understanding that biology, understanding how to root out the bad actors, if you like, in your immune system is something that has been a very significant interest of mine over now many decades.
Patients present with symptoms such as unexplained fevers, chills, drenching night sweats, unintentional weight loss, itching, rash.
People will notice, for example, in their neck or their armpit or something like that, an enlarging lymph node. And usually it's painless, but when a biopsy is taken, and that's a really important way to know that you have lymphoma, there is a very big spectrum of lymphomas, some of which we call very indolent, meaning they are very slow growing, may not cause trouble for years, and in fact may not require any treatment, at least initially.
Some lymphomas that are more common in younger patients, like Hodgkin lymphoma, some of the T-cell lymphomas, lymphoblastic lymphoma, and then most of the non-Hodgkin lymphomas are a lot more common in older patients.
There are genes that may put you at more risk, and then if a second hit, something like an environmental exposure comes along, the two are then a bad mix, and that's what precipitates people getting lymphoma.
Patients with autoimmune diseases like lupus or rheumatoid arthritis who have a very active immune system, as well as patients with HIV who have a low immune system are at increased risk of lymphoma.
One of the things we do exceptionally well here is take care of the complex patient who has needs in different disciplines.
I think working with your physician provider and your physician's team, patients with lymphoma can have an excellent outcome overall.